Every woman is at risk of developing breast cancer, and this risk increases as we get older, especially over 50. 1 in 9 of us will develop breast cancer in our lifetime. And while uncommon, men can get breast cancer too.
When I was 27, I found what I thought was a lump in my breast.
I was 56 years old.
48, 43 years old.
The exact causes of breast cancer? Well, they're unknown. But what we do know is that there are certain risk factors that can increase your chances of developing the disease. You can influence some risk factors, while others you can't, like getting older, being a woman, and having a family history of breast cancer. Understanding these factors may help reduce your risk. The New Zealand Breast Cancer Foundation wants you to know that most women who get breast cancer don't have a family history with the disease.
There's absolutely no history of breast cancer in my family on either side. I'm the first. So that became a big shock. It was also a massive shock that I was just 31 years old when I was first diagnosed. Even then I thought, God, this is an older woman's disease.
The majority of breast cancer cases are in women over 50. However, if your mother, sister or daughter has had breast or ovarian cancer, and particularly if they were under 50, you may have a higher chance of getting breast cancer. And this one, that applies to the blokes too. It's important to know about the incidence of breast cancer on both sides of your family and discuss this with your doctor. Your breast health may need closer monitoring.
My mum was diagnosed when she was 48, and then my auntie was diagnosed under 50 as well. So I think it's about, as a family, being aware of it and onto it, and knowing that it's something that we do have to be careful of and look out for.
All breasts are different. Some women have a higher percentage of dense breast tissue, which may increase their breast cancer risk.
Okay, hold your breath, please.
When I first developed very dense breast tissue, I understood that the problem with that was that it would obscure any potential tumour. I now know from the research that I've read more recently that in fact that level of breast density was actually a risk factor in itself.
Breast density isn't something you can feel. It can only be seen on an X-ray. You may wish to ask about your breast density after your next mammogram. The good news? You can reduce your risk through lifestyle choices. Many studies show that women who are overweight, especially after menopause, have a higher chance of getting breast cancer. Maintaining a healthy weight along with regular exercise will help to reduce your risk. Research has shown that alcohol is linked to breast cancer, so try and cut back to no more than 1 standard drink a day.
Have you had your check-up?
Exposure to hormones can also affect your breast cancer risk.
Many of us who are menopausal of age have terrible problems with hormones. And if the quality of your life is bad enough that you need to take hormone replacement therapy, then obviously you need it. We do know that after 3 years of hormone replacement therapy, your risk of breast cancer goes up. So definitely after 3 years, I advise my patients to start thinking about whether they still need it. And certainly after 5 years, the risk is really too great. And then once we've done one side, we merely go on to the other. The oral contraceptive pill at a young age is quite safe. In fact, it's protective for ovarian cancer, so it's a very safe thing to be on. But we do know that over the age of 40 on the oral contraceptive pill increases your risk of breast cancer as well.
So, know your risks and try to make lifestyle changes where you can. Maintain a healthy weight, build some regular exercise into your week, go easy on the alcohol, and talk to your doctor about the potential risks of the pill or HRT after 40. And make sure you share any family history of breast cancer with your doctor. And to further reduce your risk, start regular mammograms at 40. For more advice, call the New Zealand Breast Cancer Foundation on 0800 BC Nurse or talk to your doctor.